It's the Break It Down podcast by Nigeria Health Watch. This is where we help our audiences, our listeners, understand all of these sometimes complicated conversations we are having in the health space. How do we make sure that they understand these things and they use the information to make informed decisions? Not just informed decisions, to demand for better healthcare. And on this special edition of it, it's the first time actually we are bringing the Know Your Health Rights campaign as part of the Break It Down podcast. And essentially it's going deeper into breaking things down. What are those things and policies that government is putting in place to make sure that we all have access to quality healthcare? And today we are diving deep into those who provide the healthcare, right? The health workers, doctors, pharmacists, lab scientists, optometrists, nurses, radiologists, so many of them. How do we make sure that they are staying? How do we give them the support, everything they need to stay and work with us and giving their best in the country? Because of course, we all know without them, we won't be talking about healthcare. And without them, we won't be talking about quality healthcare for you and for me. Because we all know the issue around brain drain, right? Everybody wants the best for themselves. Of course, we all have responsibilities. So sometimes it's, if it goes out of control, it becomes a problem. So on today's edition, we have people who are really at the front lines of this conversation, those on the side of providing the healthcare, and someone also from the side of making the right policies, creating the right environment for health workers to thrive and for you and for me to access quality healthcare. So on my right, I have Dr. Adaeze Okonkwo from the Federal Ministry of Health. Welcome to the show, Dr. Adaeze.
Thank you very much, Chibuike. My name is Dr. Adaeze Okonkwo. I'm a consultant community physician and a deputy director in the Health System Strengthening Department of Health Planning, Research and Statistics, Federal Ministry of Health.
Thank you
for having me.
Thank you so much. It's good to have you. On my left, I have Dr. Nnenna Oji.
Thank you so much for having me. I'm Dr. Nnenna Oji, and I've been practicing medicine in Nigeria for the past 9 years. So I'm glad to be here and be part of this conversation.
Interesting. For the past 9 years. So you've not Japa, like we usually say.
I haven't. I'm here.
Yet. Is it haven't yet or haven't?
I haven't.
Okay. Let's hold that. Let me not. Okay, but so maybe we'll start the conversation this way. What has kept you going for the past 9 years of graduating from medical school, practicing and helping to provide healthcare for Nigerians?
Okay. Thank you for the question. So I would say that my reasons for staying in Nigeria have changed over the years. Initially, when I left medical school, I was such a patriotic Nigerian. Everyone who knew Nnenna loved Nigeria. And, that was the reason for staying back. Plus also the social support here. My family is here. My friends were here then. And, so staying back, there were a lot of things to gain by staying back. But over the years, as I've gotten into training and gaining more experience, sometimes I because sometimes I see the opportunities, staying in Nigeria to grow in my profession. So I'll say that those have been the things that maybe have kept me in Nigeria up till now. Yeah.
Interesting. You said something that I want to pick up before we go to Dr. Adaeze. You said when you left medical school, most of your friends were still, they form part of that support system that made you decide to stay. But over time, I imagine this is not the case. Can you just estimate give an estimate of how many that have, moved, that are no longer practicing in Nigeria?
I think the way I would say is that I can count on maybe on one hand or so, how many friends of mine are still in Nigeria, who are medical doctors still practicing in Nigeria. So
Wow.
most of the people that I know, a lot of my classmates, more than half of my class is outside the country. More than half of my friends I can actually count on just one hand how many friends of mine are actually left who are still in Nigeria practicing medicine.
So with one hand, that means less than 5 or just 5?
About 5
Wow.
top 6 or something like that.
I mean, I think that clearly shows how serious this problem is, and that will now take me to one of the reasons, why we are here today. Apart from, of course, getting these personal experiences, which for me, I think this is really profound, showing this, like, the reality of what we are talking about, this issue around brain drain, health worker migration. So I'll go over to Dr. Adaeze. Now the government is trying to make sure that when we ask Nnenna how many of our classmates are still around, she'll be able to count it with maybe 2 hands, or maybe with her toes as well, and not just one hand. And the government introduced this policy, health worker migration policy. Really, in a nutshell, what is it? Because someone out there can, without understanding it, someone can think, oh, government is trying to force health workers to stay. All of those misconceptions. And again, that's why opportunities like this, we try to break things down so people understand better, and also in any way they can support it, they can support. So what exactly is the health workforce migration policy?
Okay, so thank you very much, Chibuike, for that question. I think it's not more news that a lot of health workers are leaving the country. But to get the scene, or to tee this conversation off, I think it's very important that we get a bit of background to this. Now, the World Health Organization predicts that there will be at least 10 million shortage of healthcare workers by 2030, and that this shortage will be disproportionately affecting the low and middle income countries, which of course, Nigeria is one. Then I will also give another statistics that currently we have a skilled workforce density of about 1.3 per thousand, which is something that is way below the WHO recommendations for that. And going further, I would also like you to understand that at this point, Nigeria ranks among the countries with critical health workforce shortages around the world. But the thing is that despite all of this, we have increasingly become critical suppliers of health workers abroad. Okay, and so I know that sometime between 2001 and 2021 and 2022, we were one of the highest suppliers of healthcare workers to other countries. I think ranking second only to India or something like that, which of course you can see that's something that we need to be worried about. But then, having said that, I think it's on this basis that the government felt that there was a need to look into this and start to put our best foot forward with respect to addressing some of those things. Okay, but then also in that light, we also recognize that there's a backdrop also that people have human rights to migrate. Okay, and so in doing this policy, the national policy on health workforce migration, that is also put into consideration. So what does the health workforce migration policy seek to achieve? So it tries to take a whole of government approach and advance multi-sectoral engagement to ensure that we optimize our available workforce, and where possible, start to improve the workforce landscape, and where possible also start to reverse the migration, the Japa that you know about and all of that. And there are lots of ways that this can happen. The policy has set out a couple of policy options for that. And of course, it's quite a number of them. There are some very key areas around incentives, around professional trainings around increasing monitoring and evaluation, around ethical conduct and all of that. It's a whole package of which I think that when we start the implementation, the world is going to gradually start to maybe halt and then turn around that which is plaguing us, the health workforce migration. Thank you.
Thank you so much. So in the spirit of breaking things down, because like I said, the whole idea of this platform is to help people understand. Just quickly going back on something you said around health density. So you said something around 1.3 to 1,000. So I understand there is this data around ratio of health workers to
the population.
Yes, so
exactly.
That's what you are referring to. So 1.3,
around 1.8, I would say.
Health workers.
Yes.
So
skilled health workers.
Skilled.
Yes.
So that's like
not just
doctors.
Not just doctors.
Okay.
When you start to break that down, the numbers are quite. Well, I don't have it off head here, but if you start to break that down, they are different for doctors, for nurses, for all pharmacists and all of that. There are different figures for that.
Awesome. Thank you for clarifying that and breaking it down, because here we break things down as much as possible. But so I was going to ask in terms of the policy now, steps in putting it into place. But you said something around when implementation begins. So because I was going to ask Nnenna because this is like so you are on both sides now. You are trying to get health workers to stay, and we have someone representing them sort of here. So I was going to ask her if they are getting the feel already, what the feel is like in their own right, in their own space, their work environment and other things. It's, of course, you need to put the right structures in place to start implementing. I guess I'll tweak that question to what is the feel, what is the reception like, when it comes to this policy? Is it being misunderstood, or people are looking forward to its full implementation and looking forward to ways it will start impacting you and your colleagues?
I would say that the initial reception, I think the policy was released late last year or thereabouts. Yeah. The initial response to it wasn't good. People were very critical of it because they felt like the government was doing everything, that it had the power to do to get people to stay back in Nigeria. And even though it said that it was developed with a human rights approach, people don't feel that way. They feel like this is just giving the government a legitimate reason to keep people back when they've not provided an enabling environment or solved the issues that are causing the pushback. So they're causing the emigration. Yeah, so it wasn't received in good faith, I would say. Yeah. Okay,
so in terms of the policy now and the reception, were there specific areas? Because this is an opportunity now to feedback. And again, this is public conversation. We're going to put this out, so other colleagues can also join in that conversation. Were there specific areas that, health practitioners had those issues, or just the policy itself? That's the misconception around it.
So I remember last year the Nursing and Midwifery Council, they had an issue with giving nursing, doctors is called certificate of good standing. I don't remember what it's called on the nursing end, but they had that issue with obtaining those certificates. So currently also medical doctors are also complaining about the cost of obtaining certificates of good standing, of how price has skyrocketed. And so those are part of the issues that are causing the pushback against the policy. And so I think that's for now. And actually not actually seeing, there's a policy, but we can't see everything that is supposed to happen from the policy happening around us. It's not like yes, there's been some review of salaries and some allowances, but it's still not meeting the inflation, keeping up to inflation. Also the job work environment, a lot hasn't changed. So all those indices that people would use to check whether the policy is actually going to curb the emigration, it hasn't changed. In fact, this morning I actually asked someone that I'm going on a podcast, what is the reason you left Nigeria and why would you come back? And he said that those reasons why he left haven't been addressed. The job security, the working conditions, all of those things haven't been addressed. And it's a good thing that there's a policy, but these have been issues that other policies that are already available should have addressed. So I think that's one of the reasons. Those are the reasons.
Thank you so much. So, Dr. Adaeze, something she said, I think you also mentioned it about reversing that brain drain. Yes, we're experiencing brain drain, but there's also the thing where it's happening, but not as much as we would want it to, where people who have left are coming back. They've gained the experience, they've gained the network, and they're coming back to also impact. And you mentioned this, she also said it now, asking that colleague, are there ways that this policy will help that? We refer to it as brain gain. Yes, it's draining, but they're also gaining the capacities and skills and sometimes coming back. We've actually had a whole conversation and conference around brain gain as Nigeria's opportunity to improve the health sector. How will this policy address that?
Well, thank you very much. She's mentioned quite a couple of things, but I think one thing she missed mentioning is around security. It's another background to this. It's also very important to know that some of the push factors, when there's migration, there are pull factors and there are push factors. And more of the things that she's talked about are the push factors. Now, some of those push factors actually fall outside the direct control of the Federal Ministry of Health, requiring multi-sector or multi-ministerial departments and agencies of the ministry of the government to be involved in making sure that these things work, which is why I said that this takes a multi-government, a whole of government approach to addressing issues. Now, when you talk about the environment, when you have a policy, the next step to that policy is to operationalize it, which it means that you have to develop the strategic plan to put that policy into operation. Okay, but while that is ongoing, she mentioned this was launched late last year. While this is ongoing, there are already things that are happening in the sector that are worthy of mention. And not a couple of weeks back, I'm sure there's the Renewed Hope Health Medic City that is having buildings for healthcare workers, I think up to 10,000 in the first phase. And some of those things are also meant to encourage people, get people's their patriotism, maybe you could buy patriotism if you say that. And then we also know that at this moment there's capacity building of minimum of 100,000 health workers, frontline health workers, that is ongoing. And then when you look around, also implementing the task sharing policy, where some really more specialized tasks, people are trained and such tasks are now handed over to them to ensure that things flow the way they are supposed to. And then you go around issues around incentives. She mentioned that salaries have been increased, but the truth also being that even though the inflation is everywhere, really, the government is doing what it can to ensure that people have a living wage, something that when your salary should be able to take you home, and that is in that spirit that you're seeing some of those revisions in wages and salaries coming into play. But then again, I think it's also very important to mention that when we say some of those reversal of brain drain, at this point, there are conversations ongoing with especially the Medical Association of Nigerians in the Great Britain, Mansang, the Americans, and all of that, to see how they can start to give back to the system. Even if you haven't come back to stay fully, we can have there are plans to like have sessions of skill transfer, knowledge transfer, and all of that, so that those skills and knowledges that are being gained can be transferred to the people that are here. And if at the end you still want to come back, there's also plans for the reintegration program, to make it easy for them to fit back into the system should they choose to come back. So those are some of the things that governments that are provided for in this policy that the government is trying to push to ensure that we start to reverse and gain. And in addition to that, I think it's also very important to point out that most other countries that have migration, it's usually a win-win for the government, where you have maybe either the government that is remitting something to the government, towards increasing medical or be health worker training and all of that. So some of these conversations around having multilateral, bilateral agreements where countries can, whether it's supporting the institutions and all stuff like that, are also things that need to happen. And I also forgot to mention earlier that I'm sure it was announced in the news that the coordinating minister had announced that there's been an increase in the quota for training for nursing and midwifery, med school, and most other cadres. And what government is also trying to do is not just making those pronouncements, but also making effort to get the resources to support the infrastructure upgrade that will come with those proclamations. And so I think those are some of the things that are provided for. Thank you.
Thank you very much for that. So just before I go to Dr. Nnenna, something you said that I think you just took that from because I had intended to ask that question, because one thing we do in our work is we are very deliberate about learning what others are doing. This issue we are having, it's not unique to us. Others are probably having the same challenges. So when you said other countries, I was happy because that I was curious to also know how other countries are addressing these issues. Maybe not too far off. Do you have any examples in Africa, any other of our peers or colleagues in Africa, how they are addressing this issue around health worker migration? Because at the end of the day, like you said, those push factors, they are similar in most places. People want better income for their skills, people want better environment to practice, they need infrastructure. These issues are everywhere. So I was just wondering if there are examples that we can also look at.
I think I will maybe not in Africa, but we know that which country is it now? I think the Philippines is one country that has tried to have maybe put in place, I don't know if I would call it MOUs or legal requirements for their migration, where they produce health workforce specifically for countries. So if you want based on, obviously they've expanded their pre-training and their intake and everything else that needs to produce for them, they need to do to produce the healthcare workers. And it's like an export. They export their healthcare workers and they gain exchange for that as part of what they do. So that is why I'm saying that at some point it's not just about us bringing them back. We can gain a lot also, because we have the young population, we have the demographics, we can train our youths. And so the pronouncement by the coordinating minister expanding the scope of intake for health schools that train, is something that I think in the right direction, and working to match the infrastructure upgrade that is required. Like I said, we could also start to produce as exports, but this time not that people are just going, but the country gets some things in return, based on agreements that are signed, whether it's be it bilateral, be it multilateral. For me, I don't think the government is going to tell everybody to come back. They're not going to do that. But some of those approaches to ensure that we maximize this such that it's a win-win for everybody are some of the things that are currently being put in place.
Thank you very much. So Nena,
Yes.
these policies, right? It's sometimes they are, I feel, maybe a bit too technical. We bring in the consultants, we convene the meetings, roundtables to come up with them. Like Dr. Adaeze said, after that, the next thing is putting a strategy in place to start implementing. But in terms of the creation itself, how heard do you think do you think you are heard enough, you and your colleagues? When I mean you now, I mean health workers, that because you are here sort of representing them, your colleagues in that space. I know you have your leadership, that sometimes have these sittings or meetings with the government, but again, even if they are having those meetings, you should also take insight from you at the front lines, health workers, doctors, lab scientists, pharmacists, and whatnot. So even if they are meeting them, of course, everybody can be in those rooms at the same time. I'm just curious to know, do you think, your voices are carried along? Because at the end of the day, yes, it's a whole of government approach, but it also should be human-centered, because these things are made for humans at the end of the day, to make life easy for us, for everyone to be happy, even though it's not very realistic to make everybody happy. But just curious to know how you are carried along, and if you feel this captures your experiences. Yeah.
Okay. I would like to say that health workers and the government, everyone wants Nigeria to be better. So, and I've gone through the policy, and I checked the stakeholders that were involved. There were a lot of both the MDCN, NMA, Pharmacy Council, Medical Laboratory Science. So the stakeholder engagement was quite broad, so a lot of people were represented in making the policy. And if you go through the policy, you see repeatedly where it's mentioned that the issues are political, social, economical. So, and there was a thorough situational analysis that was done before it was produced. So I think as regards that part, I would say that yes, it talked about those issues. It talked about the push factors as regards immigration of health workforce in Nigeria. So I would say that yes, it addressed the push factors as a policy document. So we're waiting is the operationalization that's we want to see it being perfected.
So I think just to add also that during the development of the strategies, everybody is still also going to be in the room. Okay. So everybody's voice is still going to be heard in suggesting how those things that are in this policy, how we're going to really operationalize them to ensure that it works. So that is, like you said, yes, whole of government, human-centered. Those are the keywords.
Awesome. Thank you so much for sharing this insight. So as we wrap up, I guess my final question will be, so imagine you are here representing all of your colleagues, and you are, Dr. Adaeze is here representing the government. So imagine you're talking to the minister right now, because essentially this message we hope gets to him. So what would be your message to him? And so 2 questions that I want you to sort of close your thoughts on. What would be your message around this policy, not just this policy specifically, but the issue that it is trying to address? Let's just imagine the policy is not here. The policy, we know what the issue is, making sure that people have access to the best resources, the best environment to thrive in their work. So what would be your message to him to make these things happen? And finally, what do you hope, if this thing eventually achieves its aims and objective, what do you hope it will mean for our health sector?
Okay, so I would say that in addition to all the issues that the policy tries to address, which we've talked about extensively, I think it will, to also bring in the aspect of the buy-in of the Nigerian population in the health sector. There's still a lot of distrust in the Nigerian society for the Nigerian health sector, Nigerian health system. When people have major health challenges, many people don't think that Nigerian doctors or Nigerian health workers are able to answer those challenges. And so I think that part of that would be to have that political buy-in into the Nigerian health system. So, let's have the political elites patronize Nigeria. Let's patronize Nigerian made. Let's patronize Nigerian institutions more. I think that would also help. And honestly, if this policy is able to actualize what it aims to, is able to achieve what it aims to do, I think it would be a big positive to the Nigerian system, because there are people, even though they are out there, they really want to come back and develop the system. Nigeria is home, will always be home. So there are people that really want to come back, and if this policy is able to give them that avenue to come back and develop the system further, they'll be glad. And even those who are here and want to stay and want to grow, this policy, if the intentions are achieved, it will help them to have that fulfillment and that job satisfaction that they desire in their home state. And I would also like to agree that some of the issues that plague the health sector are beyond things that the Federal Ministry of Health and Social Welfare can achieve. So, and it still goes back to the minister is a member of the Federal Executive Council, and these are things that at that level they should address, because those are part of the reasons insecurity is a major issue why people are not here. And if they address those things holistically, then I think more people would see coming back or staying back as the better option.
Thank you so much, Dr. Nnenna, for sharing that. And Dr. Adaeze, again, your final thoughts as we wrap up. What would be your message to health workers who we are trying to I say beg, or yes, not just beg, but also we're being realistic here. Try to address those push factors that are getting in the way. Yes, understandably so, not everything is within the power of the ministry to address, but as much as possible, what would be your message to them as we all of us work together to address this? And as you put that on, I'm also curious to know what's the plan, or what's the level of involvement of the private sector, right? If we're targeting health workers, those things most times, see if it's the public sector or public institutions that we are targeting. How about the private sector? Is there that collaboration as we work to address all of these issues?
Okay, thank you once more for that. Maybe I should start from your last question and work back up. The private sector is very, very important to us, because they also cater to a huge chunk of Nigerians. And if you look at this, I'm sure she went through it, the private sector was hugely involved in developing this. And also, if you look around the country, you'll know that the private sector is also taking up huge responsibilities with respect to producing health workers. We're having private schools, producing doctors, nurses, and all of that. And so these are some of the initial things that have started happening with respect to the private sector. And it can only get better. It can only get better. We're under leadership of someone who puts the people first, with respect to the decisions that are made. And so what I can say as my last words would be that under the leadership of the coordinating Minister of Health, health workforce issues are on the top burner. And from what I've said today, I'm sure you will also realize that a lot of things have already been rolled out, and there are still more of them, that are going to come. So I think we'll be patient and continue to do our best. Our health workers are some of the best that you get around the world, and so whatever it is that needs to happen, the conversations are ongoing. The government is able to take all of that. They are doing a lot to address that, and the truth is that this will start to yield fruits very soon. They're already yielding fruit, because a couple of days ago there was a broadcast from the table of the coordinating minister that even people are starting to seek healthcare in Nigeria. Yeah, we have some really super hospitals, the Afrexim super hospitals, employing Nigerian doctors and all of that. They're all there, you know. So sometimes we don't really we need to take a broader perspective to see all that is happening, and the trust that she spoke about, the trust is gradually being built up. Okay, I think about 2 years ago there was a survey of what Nigerians, the regular Nigerians, think about the health sector. I think that's been done. Last year was also done, and while I don't have the figures up here, but there's been a at least reasonable increase from what the figures were 2 years ago to what it was last year. So it's work in progress. It's not just going to come and drop like a bomb, but I want to assure us all that there's a lot ongoing, and there's also a lot in the pipeline to ensure that Nigerians get the best possible outcomes. The health sector strategic blueprint is there, the 4 pillars and all of that. We're talking about the presidential initiative on unlocking value chain. It's going to make space for massive employments in the production, manufacturing sector, supply chains. We're also taking a stand towards addressing inefficiencies, the sector-wide approach that the coordinating minister is heralding within the Federal Ministry of Health. So a lot is happening. I can tell you that. And I know that all of this have already started translating into improved health outcomes for Nigerians, which actually is the ultimate goal of everything that we're doing. Thank you, Anova.
Thank you very much, Dr. Adaeze, for those final thoughts, and thank you also for being on the show, Dr. Nnenna. It's a wrap for the Break It Down podcast. Today we talked about Know Your Health Rights, and specifically the health workforce migration policy of the Federal Ministry of Health and Social Welfare. We keep the conversation going. For me, the key takeaways are more trust in the system and patience as these things gradually materialize, because it won't happen overnight. But until the next time, keep engaging in conversations that improve your health. I am Chibuike Alagboso, and see you on the next one.